So today I'm going to be talking to you about my patient that I have for Miss Elliott's ortho class, and he has tennis elbow, so let's get into that. So just a little bit of background on my patient. He is a 48-year-old male. He is an engineer, so that means he has to write and draw a lot at work, and that was part of his goals, and we'll get into that later. He is right hand dominant, and he had an onset of the lateral epicondylitis when he played in a 4-day tennis tournament. And after the tournament, he rested for a few days and realized that it went down, and then it flared back up 2 days before he came into his first physical therapy treatment, and that's when he realized that something was going on. So we'll just get into what tennis elbow is. It is also called lateral epicondylitis, which I've already mentioned. And what it is the most common, overused or over repetitive wrist injury or elbow injury. And it is inflammation to the wrist extensor insertion on the lateral epicondyle, and it's just, like I said, caused by overuse and repetitiveness and things like that. So some things I would reassess with my specific patient subjectively each session is his my mind just went blank. I'm sorry. Oh, he has a dull ache in his in where that lateral epicondyle is, and I would just ask him how that ache is doing, if it's getting worse, if it's getting better, and just help kind of reassess his therapy on that as well. And then I would also reassess his aggravating factors, which to him was things like hammering, opening doors, playing tennis, riding at work for greater than 30 minutes, just things that he needs to do in everyday life. And then objectively, I would reassess his active range of motion and passive range of motion, and then also dynamometry, which is a device used in clinics to help assess people's grip strength. And what it does is it measures how hard you're squeezing it in pounds. And what our patient was able to, or what my patient was able to get to on his left hand was 100. And so you would think if he's right hand dominant that he would be able to get a higher pounds on his right hand, but he actually wasn't. He was only able to get 75 pounds on that hand. So I would keep reassessing that to see if it's getting better and see if that arm's getting stronger. So for my soft tissue mobilization that I would do for this patient, I chose to do light transverse friction to the lateral epicondyle or the wrist extensors tendons. And what that's doing is it's going to bring blood flow and oxygen to the area to help heal any damage that the inflammation has caused, and help him not have things in the future disable him in that arm or disable him from doing anything. And subjectively, what I found for him was that an easing factor for him was rubbing it. So this light transverse friction would be a great option for him. And I actually have a video of me doing this to someone. So what I'm doing here is I'm on, like I said, right on the lateral epicondyle, and then actually went just a little bit distally more to where I'm on the wrist extensor tendons, and you can actually feel them if you extend your wrist, and they just pop right into your thumb there. I'm going to have this play again, and I just did, with some lotion, some transverse friction right there. And like I said, what that's doing is just helping break up like any scar tissue that there may be, or just bringing blood flow to the area to help heal that. So that was what I chose for my soft tissue. And then for my patient education, what I want him to do at home is a wrist extension exercise, and I would have him do 3 sets of 10, 2 times a day for 5 days a week. And my reasoning behind that is to help strengthen those wrist extensors so that he's able to do all of those just ADLs that he needs to do, such as riding for a long period of time at work, so getting back to tennis after he takes a rest while he's in therapy, hammering, opening doors, opening jars, things like that he needs to be able to do in his everyday life. And so I have him doing this wrist extension exercise to help strengthen those. So initially, right after his initial eval, I just want him to do it with no weight, just doing his hand. And then after his re-eval, I would progress it to him maybe doing it with a can of beans if he doesn't have weight at home, or if he does, then hopefully getting up to like 10 pounds if he's able to. And then I would just caution him on, if it's bothering him, if it hurts, if it seems to reproduce symptoms, to go slower or to not do as many reps. And if it's still hurting, then to let us know when he comes to his next treatment so that we can modify it or give him something else to do. And then subjectively and objectively, my reasoning, I'm sorry, I'm going to have to look at it, behind this was that he would be able to, like I said, one of his goals was to be able to write for greater than 30 minutes at work. So that was my reasoning behind that. And here is a video. So the patient that I had, or the guy I had doing this, he was going kind of fast at first, so I actually had to cue him to slow down, and that's what we may have to do in real life, so it was good practice. But I just cued him to slow down a little bit while he was going. I believe my video paused, and then you can actually see his wrist extensors popping up right there once I move the camera. You can see them popping up right there, those wrist extensors and those wrist extensor tendons. So his prognosis, I would expect this patient to recover probably within 3 months. It can take up to 12 months, this specific tennis elbow can. However, this guy was pretty active and he seems pretty determined anyways. So I'm going to expect him to recover within 3 months. I expect him to have a full recovery and for him to have a pretty fair and good prognosis and be able to get back to doing all of his things, writing for long periods of time, hammering, opening doors, opening jars, and getting back to playing tennis, because we did recommend for him to stop playing tennis while he's doing therapy after his initial eval. And then at his re-eval, the therapist suggested that he starts playing tennis a little bit progressively, just starting out with maybe 10 minutes and working his way up to a longer period of time. So anyways, I expect this guy to have a great prognosis. So I hope this taught you some about tennis elbow or lateral epicondylitis. Same thing. For this specific patient, it was called tennis elbow because that's how he got it. However, some people contract it in different ways. So lateral epicondylitis is what it is mainly known for. But I hope this taught you some more about it and gives you some ideas for treatments to do for your patients. Thanks for listening. Bye.